Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. Welcome to Prevention Hacks. We've got Dr. Adrian Falkov here with us today. You're a child and adolescent psychiatrist, so welcome, Adrian. Thank you so much for your time.
Thank you very much, Kevin. Good to be here.
So I can kick off, and you specialize in relationships and family dynamics and how that may impact kids and their emotional health. What are some of the common issues that you see when it comes to family dynamics and how that may impact mental health for kids?
So setting is important, and I have both a public sector hospital-based job as a child and adolescent psychiatrist, and I also work in the private sector and do a bit of work with primary care. So it covers the broad spectrum. Really, the high prevalence, so the most common conditions that are coming into services across the board are the understandable ones: depression, anxiety, but also at the more severe end, the bipolar conditions, the psychoses, and probably, certainly over the past year, it's been very evident the impacts and complications and consequences that arise from adversity. And that adversity can take many forms, from adverse life events and losses through to the various forms of abuse. So that there is an inevitability of mental health being an issue in day-to-day functioning, and there is an important message that adverse outcomes are not inevitable. I think the theme of this podcast is around prevention, and that's really critical. It's particularly critical at a time of unprecedented demand from rising mental health challenges for young people of all ages, children, young people, and therefore for families.
Adrian, how much of...
You go.
Well, look, my question was how much of it is preventable, and what should people be thinking about to try and tackle these kinds of issues?
Well, that's really a critical question. There are, in this day and age, many good evidence-based interventions to support good treatment outcomes, and good treatment outcomes have a preventive element in their own right. And Australia has done pretty well in terms of funding and committing to prevention, broadly speaking. However, it's the challenges and complexities that have arisen over the years that make easy and quick outcomes and evidence of prevention more challenging to achieve. So probably one of the biggest issues is stigma. So that gets in the way. That kind of features everywhere. It's an ever-present, ubiquitous factor or interfering variable in the seeking of assistance and in the provision of assistance. Right people with the right challenges at the right place at the right time, and stigma is a massive issue.
So
Yep.
that would be about, I guess, people recognizing that there's an issue and doing something about it.
That's right. That, struggling alone or struggling in silence, as opposed to seeking help, asking questions, talking with others. And really, one of my most important messages is that, when it comes to mental health, the importance of the conversation starting at home, within families. The
What are
ability
the
for
kinds
that.
of
Yeah, sorry, you go.
what kind of signs should people be looking out for if their kids are, is it just unusual behaviour, things that, acting out? What are the kinds of things that should be early warning signs?
Well, I think it's about the having the communication and connections that in itself becomes the bedrock or the base for being able to talk about issues. And when it comes to what to look out for, it's about change. It's about a child or a young person noticing that a mum or a dad is a bit more withdrawn, is not talking as much, or perhaps has become more irritable. Now, these are things that could be explained away could be happening for a variety of reasons. But if the conversation is there, then there is that facility for the young person's confusion or perplexity around this to be able to, that person can ask, why are you so irritable, mum? Or, why are you getting angry, dad? Or why aren't you coming out to play with me? Can we go and play cricket or whatever? And you said no yesterday and the day before and the day before that. So it's really the ability to, have the support for conversation and questions.
Adrian, are there some practical tips that you can provide, just given family dynamics can be quite complex, and certainly there is a genetic component to mental health, but there's so much of it is social and environmental as well. Some practical tips that you would provide to families on how to have those conversations or how to initiate an assessment, maybe even seeking help.
Yes. So my starting point is a message around individuals and family members not underestimating their own capabilities and resources. So that ability to have that shared conversation is a tremendous resource and a great starting point. And much can be accomplished around that. However, as we've said, things can be more challenging and complex, and so I think perhaps the family model, which is a tool that I've been working on over a number of years, which is a visual illustration of key areas that are relevant for individuals and families, and there are 6 areas that are particularly important. And perhaps I can run through that briefly. And, for each of those areas or domains, as I call them, it's an area of focus and there's something that, can be looked out for and a question to go with it. So, the first domain represents in the model. And if people are interested, there is a website. I guess you can share that information with listeners. And so there's a lot more detail there. But the first domain represents adults and particularly parents. And the question there is the broad question of the adult, being able to ask themselves, how am I doing? Am I in a good place or good space, or am I struggling with something? And should I seek help? It's a bit like the airline analogy with the oxygen mask. That in order to be able to help others, one has to be, in a good position oneself. So it also is good modeling that seeking help when there's a difficulty is really important for children and young person to see. It's actually the very opposite of weakness. It's actually a real strength. And when children and young people see this, it can really, give them the confidence to then be able to do the same with their parents when they are struggling. The second domain covers or represents children, young people of all ages. And there, the issue, because of the disparity in age, because of the dependence in children, one of the things that's become clear to me over the years is the extent to which young people and even very young children worry about their parents, and the extent to which that can get in the way of them being able to seek help. Or sometimes young people will tell me, well, they are struggling, but they really don't want to overburden their parents who are also struggling. So that question for them is, kind of, how is mom or dad doing? Some very able and resilient young people will actually ask that. But you can see how that question doesn't relate directly to themselves. How am I doing as a child is really the important question, and it's a difficult one for them to ask. And so, hence that ability to create that environment, that if a young person is struggling with irritability, lack of sleep, low mood, tearfulness, struggling with self-harm or suicidal thoughts, the single most important question is who to turn to. And in the older young people, obviously peers and friends become an obvious source for support. And whilst it's important, I always try and encourage that first level of help seeking to be within the family and between a conversation between young people and parents. The idea that a treatment focused rigidly on one person is an insufficient approach. It's really how to help that young person or that child feel able to have a conversation, or for the parent to be able to create the environment in which they can have their conversation.
Just on that, Adrian, do you have any practical tips on for younger kids or even adolescents where to turn for help if within their family it may not be easily accessible, or should they be thinking about online resources?
Yes. So I think really important that what I've talked about is what's preferable as a starting point, but as you say, it often isn't. So a number of important options, Kids Helpline, Beyond Blue are the sorts of facilities as a starting point that can be really helpful, particularly if there are serious worries and concerns around safety. GP can also be a very good option to have a conversation. And in fact, within schools, a good teacher goes a long way as a key adult who can help and facilitate, or the school counselor. So there are coming to be a range of options in the statutory sector, in the primary care sector, and in the non-government sector as well. So those would be some broader options in the event that there are challenges and struggles within family. So that was domain 2, which is focused on children and young people. The third domain represents family, represents relationships, and there it's what I've been talking about already and trying to emphasize and highlight. It's an area in the model which ensures that those participants in the conversation are actually able to see it's in the center, the importance of communication. And communication can be double-edged. communication can be hugely protective, and a good communication is probably the best example of prevention in action. But poor communication, struggling communication, is also a significant factor in precipitating or in perpetuating struggles, including mental health struggles.
Sure.
So that communication and that domain 3 represents the importance of connections and communication.
And is that slightly not only the health-seeking behaviour, so reaching out for help and encouragement to do so, but there's a lot of research around social isolation and the importance of social connections.
Yes.
And in lay terms, that might be just getting stuff off your chest and talking to your mates. Is that a large part of it as well for kids?
Well, I think that's a part of it. But in terms of where do we start, where does the strength and resilience building begin? Where does help seeking begin? It begins at home. Mm-hmm. And then, that strong base, encourages and supports reaching further afield. Sure. And so, friendships and beyond become really important. So that's the third domain. The fourth domain is a split which represents both vulnerability and resilience. So strengths and struggles. And my emphasis and the model makes both of those issues explicit. It doesn't favor one or the other. This is rightly big emphasis on resilience. But the reality of day-to-day life and the reality of struggling with day-to-day difficulties is that the route to resilience and recovery starts with the vulnerability. It starts with struggles. And we have to recognize that. We can't just impose resilience on people or here's a recipe of what you do. It's validating their struggles by showing the importance of the adversity issues and working together in finding that pathway through, or the stepping stones to learn from adversity. The question I would that sort of captures that fourth domain, the strengths and struggles, is the question, what gets you through? So I often ask that of people. And it's not a simple question. It's not a tell me your strengths or let's focus on your strengths. It's actually inviting people to think more carefully and more deeply about what is really happening for that person and to reflect on themselves in the midst of the crisis. So it's really trying to look at resilience and vulnerability in the moment, at the time of struggles happening. Because when people are coming along and engaging with me in these conversations, they're coming along in the crisis. And so it's incredibly important. There's a strength and a courage that enables people to seek help in the midst of that struggle. And I think to be able to identify or help people identify and validate that is a really important starting point.
Is that similar?
So that interplay is really important.
Right. And is that similar to, at a basic level when we do counselling in general practice, often building up that toolkit of, being aware of your issues and in a way separating a lot of the emotion around what the issue is, but then being able to get into solution mode, problem solving and working out ways to deal with it or manage some of those symptoms or how it impacts your day-to-day life. Is that part of, this domain?
I think you're describing well a good clinical encounter, or a good health-focused conversation where you're striving to get balance into that conversation. You're recognizing that a person is coming along because of a difficulty or many difficulties. And you're then inviting them through that consultation and, given that there's never enough time, these are difficult conversations to be had, because you're wanting to validate the difficulties in order to work out pathways to recovery, pathways to a solution. It's incredibly difficult to do in primary care within the constraints of time. It's generally
So
difficult.
is this about giving people perspective when they're in the midst of it?
Well, I think it is. I mean, people might have different views on exactly what form and shape that perspective takes, but inviting or facilitating people's ability to reflect on what's happening for them, when they're at their lowest, is a really important part of treatment. It says that things are really tough and terrible, and yet they're still able to participate in a conversation. They've still got that strength to be able to do that. They haven't given up. They have come along to share suicidal thoughts. They are having a conversation or trying to have a conversation about self-harm. I use those two symptoms and behaviors as a way of illustrating, I hope, that what gets you through question really attends to every level of severity. And in some ways, the more severe it is, the more impressive it is that people come along and are able to have these conversations. That's been, for me, one of the most striking and inspiring parts of the work that I've done over many years is, being part of that shared struggle and that shared pathway to finding solutions.
So struggle builds resilience, like it can be an opportunity to become
Correct.
more resilient.
Correct. Yes, it is. I describe, it's a stepping stone. That if a person has not yet got to the point of, being able to identify and recognize and do something about or with that struggle, then the magical solution is much less likely to happen. So that stepping stone is that first step, that first question or that first conversation. And hence my emphasis on the importance of family communication and family connections, because that can be an incredibly important first step. I mean, as Kevin said earlier, often there are difficulties with that, but where it can happen, it's a great first step. And then building on that is the health-based conversation, the conversation with a health professional. So, I hope that answers that particular question. Just in terms of what the model does, there's a fifth domain, which covers what we've already touched on, the service component. So for me, over the years, what became very evident, people talk about the postcode lottery of what services are available in a particular area and the extent to which that determines a person's or a family's outcome. And it's still true today that availability of services in Australia, the concentration of services in big cities and the fall off, moving into rural and remote areas, plays a huge part in health outcomes. So quality of availability of services, quality of services, and then within that, most importantly, the sort of relationship that an individual and family has with their health providers. And when I train medical students and junior doctors, the emphasis is on what each of us as professionals brings to that conversation, should bring to the conversation, in order to make sure that we facilitate that pathway to recovery, to resilience recovery, rather than hinder it. So that's the fifth domain, and the final domain is a wraparound which is around community and culture. So these are important things for individuals and families that sit a little more broadly, slightly beyond the immediate family. So the quality of neighborhoods, broader supports, religious beliefs, cultural support or challenges or isolation. And within that, the model also emphasizes the critical importance of the values, so non-blame and non-judgmental in having this conversation. So those are the six key areas which I've touched on, and where there can be questions or issues within each of those domains that, when brought together, supports a family-based or a family-focused care plan. So it's a shared care plan. And the importance of it is that it's been developed jointly by participants, including not just the professional telling, but family or young people themselves being part of that conversation.
That's
I
tremendous.
see a lot of advertising. Sorry, Kev. You go.
No, I was just going to say that's tremendous. Thank you for sharing that model with us, because it's so important to be thinking about the different components and perhaps not just the individuals or not just the symptoms, there and then. And I think the fifth and sixth domain, Adrian, are a nice segue to kind of thinking more broadly around the mental health challenges this year. We are seeing in our service just so many more, so much more psychological distress. I think I read 70% in a survey, 70% of Australians have had mental health symptoms during COVID. Indicators such as, even in the corporate world, there's been a doubling of workers' compensation, sort of incidents around mental health. So there's this kind of surging demand, as you say. How do we manage this at a society level? What are some ways where families, if they're thinking about this and some of these topics are resonating because the dynamics, some of those symptoms are there, but they haven't quite sought help yet, what things could we be thinking about at a community level to address this demand?
So, Kevin, it's the question, and it's got many facets to what is a complex series of answers. Fundamentally, the obvious area is the need for greater investment in mental health, and the need, the ongoing need to challenge stigma. That investment's really important. I mean, I see, both the cross-section from primary care through to the high-end complexity, the specialist mental health services. And I think it's important the government has put money, in various ways. Money's been put into organizations like Beyond Blue and trying to broaden the net to be able to, pick up that initial point of contact. And that's really important. The challenge remains that specialist mental health services, picking up the highest level of complexity, also need much, much greater investment. There's been a legacy of chronic underfunding. And so that background, that decade's worth of underfunding, has now, the creaks and the cracks and the insufficiencies have really been exposed this year. And part of the challenge is that, as you say, surge of mental health needs, but also mental health needs at the high end with young people. So unprecedented numbers of young people attending emergency departments with suicidal thoughts, self-harm, overdoses, and a growing number of suicides. So it's a hugely serious matter. And again, it's that challenge of the importance of prevention, but at the same time needing to address the need in the here and now with a view to prevention over time, giving a young person a good entry-level experience into the mental health system can have huge lifespan potential for the rest of their lives, and therefore the rest of their mental health. The opposite can also happen. It can be the beginning of recurrent revolving door attendances, insufficiencies of adequate input, and real struggles over time. And many young people go on to themselves become parents, and the legacy can become can perpetuate itself. So that investment is hugely important.
And that investment is, as you say, for the here and now. We need to address the demand now in all parts of the health system, and then also think about prevention, as you say, over the longer term. And that is interesting because even pre-COVID, my sense is that over the decades as a clinician, we have seen what we used to call in the business world a mega trend, where there has been this significant rise, and partly I think we're doing slightly better, arguably on stigma, and groups like Are You OK are really raising awareness that mental health is as important as physical health. So we're perhaps picking up more cases, but there does seem to be a lot of pressure on families. If I think about career paths for both parents, there's different family makeups. Society is just busier. We all lead busier lives compared to a generation ago. There's screen time. There's so much social media. There's pressure associated with that. I mean, do we have to live differently to kind of even get to some of the root causes, as you say, break that cycle from generation to generation? Are there things that we should be thinking about within families to change our habits even on a daily basis?
Yes, I think what COVID has done is to exponentially intensify trends and challenges that have been evident, in a growing way, over a number of years. The world has become an increasingly complex place for young people to be growing up in. And the corollary to that is that parenting has become increasingly challenging. So, the expectations and pressures on new parents, young parents are huge. And so assistance there for the same theme that I go on about, which is starting within the family. And in the face of rising stress, economic challenges, societal complexity, for individuals and families to not forget about the importance of what they bring. And so again, that's that recognizing, validating the vulnerability and incorporating that into the building of strengths. That's where the fundamental solutions lie and will continue to lie. So it's not shifting or creating more dependent families in the face of more challenging society pressures. It's trying to hold on to the best strength that there is, which is family members themselves working well together, recognizing the importance of their connections and being helped to do so when those connections are stressed or threatened. So again, my message is that in the face of these difficulties, and yes, we do need more investment, but let's not forget about the fundamental resources that family members themselves can bring, and which sometimes get lost in the chaos and complexity.
Thank you so much. We've taken a lot of your time, but I really take away these important messages: the importance of the family in and amongst mental health, and just starting that conversation, as you say, is key within the family unit. So, and of course, as a health system, we need to rally around, create investment to address that increasing demand here and now. So, Dr. Falkov, thank you so much, Adrian, for joining us today, and we look forward to keeping in touch and sharing your message and your family model more broadly. Thank you so much.
Absolutely. Well, thank you for inviting me. It's been great to talk with you guys. So thank you.
Thanks, Adrian. It's been a pleasure.